Heart disease is the #1 cause of death in the United States. The National Heart, Lung, and Blood Institute, the NHLBI, which provides leadership for a national program in disease of the heart, blood vessels, lung and blood resources, and sleep disorders, funded this project to help African Americans prevent heart disease. This web-based training session, being conducted by the project team at Morehouse School of Medicine, will help community health workers, CHWs, like you learn the risk factors for heart disease so that you can help to educate other community health workers and clients. I am also encouraging you to participate with other community health workers in the online discussion forums that will be available in the virtual classroom as well. There are a total of 10 web-based sessions that you will cover during this training. If you are also participating in the Learning Circle discussions, these sessions will be taught in more detail in the classroom. The sessions are Knowledge is Power, Know Your Risk of Heart Disease, Act in Time to Heart Attack Signs, Get Energized, Say Yes to Physical Activity, Help Your Heart, Control Your High Blood Pressure, Be Heart Smart, Keep Your Cholesterol in Check, Embrace Your Health, Aim for a Healthy Weight, Protect Your Heart, Take Good Care of Your Diabetes for Life, Make Heart Healthy Eating an Everyday Family Reunion, Eat in a heart-healthy way, even when time or money is tight. Take control of your health. Enjoy living smoke-free. There are accompanying handouts and picture cards for each session to be used when you are teaching these sessions to other community health workers or clients. Handouts are available at the end of each chapter of your manual. Electronic copies are available by clicking your mouse on each handout title. Hello, and welcome to peer-to-peer training of community health workers to improve heart health project. We will continue with session 3. Get energized, say yes to physical activity. By the end of this session, you should know that physical activity is good for the heart and overall health. Adults should be physically active for 30 to 60 minutes on most days. Children and adolescents should be physically active for 60 minutes on most days, preferably daily. Know that brisk walking is a simple activity nearly everyone can do, and that there are ways to fit more activity into busy schedules. When you are teaching this session, you'll be referring to 8 handouts located at the end of session 3 in your manual. Health Freedom Walk Role Play on page 74, Getting Started with Physical Activity on page 75, Getting Started with Physical Activity, Miss Diane's Answers on page 76, Take Heart, Say Yes to Physical Activity on page 77 through 78, Stretching Activities on page 79, How to Be Physically Active on page 80, Make Physical Activity a Habit, My Personal Record on page 81, and finally, Sample Walking Program on page 82. Electronic copies of handouts are available by clicking your mouse on each handout title in the sidebar located on this page. Let us begin with the facts about physical activity. Not getting enough physical activity is a major health risk for people today. Being physically inactive puts you at increased risk for heart disease. African Americans, especially women and children, are not getting enough physical activity. And as a person gets older, having little or no physical activity can lead to health problems. Showing picture card 3.1, you will tell your client the benefits of physical activity. Physical activity can strengthen the heart and lungs, build and maintain healthy bones, muscles, and joints, control your weight, provides you with more energy, helps you feel better about yourself, lowers your stress, reduces feelings of depression and anxiety, and improves sleep. Showing picture card 3.2, the benefits of physical activity also include lowering your blood pressure, helping control your blood cholesterol, and lowers your risk of getting heart disease, diabetes, and cancer. The final benefit depicted by picture card 3.3 is that physical activity may benefit you by helping you lose weight. Take a few minutes to discuss with your clients what they do to be physically active, then using picture card 3.4, you will want to talk about how they want to start with moderate, medium level physical activities, which include walking at a brisk pace, gardening, dancing, making home repairs, washing and waxing a car, scrubbing floors and washing windows, actively playing with children, weightlifting, taking the stairs, doing floor exercises, and doing chair exercises. Now, picture card 3.5 shows examples of some vigorous, high-level physical activities such as playing basketball, baseball, or football, swimming laps, running or jogging, bicycling fast or uphill, doing aerobic dance or step aerobics, jumping rope, skating, using a stair climber machine or stationary bike at a fast pace. There are some daily physical activity recommendations for adults. Adults should have at least 30 minutes of moderate physical activity daily. Some adults need up to 60 minutes of moderate physical activity daily. For adults who used to be overweight, they should do 60 to 90 minutes of moderate physical activity every day. And children and adolescents should have at least 60 minutes of moderate to vigorous physical activity on most days, preferably daily. Showing your client picture card 3.6 and 3.7, explain how persons trying to get more physical activity into a busy day can break up their 30-minute physical activities into shorter periods of varying exercises of at least 10 minutes or more. It is the total time of physical activity that is important. In getting started, there are some important things to know. First, it is important to know who should speak with their physician before starting an exercise program. If you are new to exercise or haven't exercised in a long time, start slowly. Build up the time and effort you put into any activity. Drink plenty of fluids before, during, and after physical activity, with water being your best choice. Wear shoes and socks that provide support for his or her feet. Wear comfortable clothing and never wrap his or her body in plastic or wear clothing that is too heavy. Take a minute to review the handout, Getting Started with Physical Activity on page 75 and 76. Some larger people may face special challenges in trying to be physically active and should start with activities including weight-bearing activities. Suggest they try activities like swimming and water workouts and lifestyle activities like gardening. Your client may say that their biggest obstacle is finding time to be physically active. Your client could try taking a 15 to 20 minute walk during the lunch break at work or after dinner. They could jump rope a few minutes each day and work up to jumping rope for 10 minutes. They could also do activities with their children like playing basketball. Use the handout, Take Heart, Say Yes to Physical Activity on page 77 and 78. To think about other ways to become more active, even when time is limited. Now it is your turn to get moving. Take a break from this session, watch the video, stretching activities, then try some stretching activities listed below. Now that you have completed this session, do you have any questions? Is there any information that is unclear to you or difficult to understand? What information covered in this session do you think community members may have difficulty understanding? Are there any issues particular to women that should be highlighted in this session? What information covered in this session do you think may be a little challenging for you to present? Why? You will have an opportunity to share your responses with other community health workers in your learning circle discussion and on the online discussion forums.